So, good morning and welcome to our King Drew Career Talks. Today we have Kelsey Paras, and she is a speech pathologist.
Speech language pathologist, yes.
Speech language pathologist. Thank you. So, go ahead and introduce yourself. Just give us a little background of who you are.
Okay, my name is Kelsey Paras. I went to King Drew and graduated in 2011. From there, I went to Arizona State, and then I got my master's from Chapman University in 2020 and started my career in the pandemic as a speech language pathologist in an elementary school. So I've also been doing distance learning in Zoom a bunch.
Thank you. Now we're going to have Favor and Faith asking you some questions. And let's start with Favor.
Okay, so the first question I have for you is, was your was your current career your dream career when you were in high school?
When I was in high school, no, I was set on being a pharmacist. And through King Drew's program, you guys know you can volunteer and test out these careers by observing. I was at the VA inpatient pharmacy, and one day I realized they don't interact with enough people for me to be happy, and then I had to search for something else.
When did you start to see your current career as something you should pursue?
That is a great question. So, I went through a journey in college. I changed my major 7 times because I had no idea what I wanted to do. I worked for the UN and I thought I wanted to do global health. I worked for different law firms because I thought I wanted to be a lawyer. And then I ended up in as an instructional aide with a special education class because I thought I wanted to be a teacher. And I observed and fell in love with what the speech therapist did. She had been doing her job for 15 years and still absolutely loved it. It's like, what do I have to do to love my job 15 years from when I graduate? Um, and so that wasn't until my 5th year of college. So it took me 5 years to graduate because I jumped around a bunch. And then I went to get my master's. So it's taken me a little bit longer to start my career, but I am so incredibly happy even in a pandemic. So I think that says something.
Okay, so could you tell us what a general salary for someone in your position or career looks like?
Okay. So the average salary for a speech language pathologist in the United States is about $79,000 a year. In Los Angeles, because it's so expensive here, it is $94,000 a year. But if you open up your own clinic, if you take on a few clients outside of your job, it's very easy to push that number over 100,000.
What was your career like before COVID-19 and how has it changed?
Before COVID, I used to be this close to my clients. They would be able to see my face. I didn't have to wear a mask. I didn't have to sanitize my toys as much as I do now. But we used to play with bubbles a lot. Now it's just not a thing we can do. Most of my job, especially with distance learning in the elementary school, is through Zoom. So I've had to become really tech savvy, find the online materials that work. I still use toys to help elicit language um, through my screen, and it's kind of like, have you ever seen those YouTube videos where they open up a toy and like, we're going to play with it, but you tell me how you want to do it? And yeah, so it's changed a lot, but it's slowly getting back to where it was as clients start to come into the clinic or I go into their home for home health.
So what motivates you to work in your career choice every day?
I'm sorry, could you repeat the question?
Uh, what motivates you to work in your career choice every day?
It's my clients. It's their smile, their progress. It's the connection that I've made with them and their families. I give my parents things to work on at home, and they can text me whenever to give me an update. But it's that word that they've been struggling with, and they can finally say, it's my clients 100%.
Okay, so the next question is your workplace people orientated?
Yes, yes. I work with I work on a team. So I work alongside physical therapists, occupational therapists, psychiatrists, and psychologists. I also work very closely with families and my clients. I have to know them. I have to know when they get frustrated because sometimes they don't have the language. I have to know that their behaviors are a way that they communicate. So when my kid throws the toy across the room, I'll layer that language on top, but that's a sign that he's frustrated and would like to do something else. So I have to really know my people and how to work with them because everyone's different.
Do you see the value in students learning things that can help prepare them for the future?
Yes. Um, I think at King Drew, we are taught to be critical thinkers. You get information, and in college and in grad school, it was a lot easier for me to process that information, understand what it meant for me and my client, and use that evidence or the research to really fuel my therapy techniques. So everything I do is research based, and I think the level of thinking you're required to do at King Drew really really pushes you. It really helps you in college and later on.
What key points would you like students to take away from your presentation today?
That is a great question. May I share a presentation, like a short thing that I did about speech therapists? It's it's a little PowerPoint. I wasn't introduced to speech therapy until college, and I would like to share with the world what we do because if you don't know it, then it doesn't, yeah. If you're not part of the speech world, it's hard to understand.
So I made you co-host. You may absolutely share your screen.
Thank you. Okay, so here it is. Speech language pathology. So speech language pathologists we base our work off of this quote: "Everyone deserves a voice." We work with a day in the life of a speech pathologist. We prevent, assess, diagnose, and treat speech and language related disorders. And we require a master's degree to get into the field, but our growth rate is 18% up to 2026. The US News report in 2020 showed speech language pathologists as the number 4 health career in the nation and number 7 overall, um, with only a 0.8% unemployment rate. So that's really high. I mean, like really low. A lot of us are employed. A speech language pathologist works with the spectrum of ages. We go from NICU babies all the way to geriatrics, and these are a few of the disorders that we treat. And I'll jump into a few of them. So, augmentative and alternative communication, or AAC, this is my specialty. I help individuals who don't have a voice, who require pictures, or like Stephen Hawking's, he requires a device to speak. And so I'll program those devices, I'll train the parents and the teachers on how this child is now communicating. Um, and he uses an eye gaze device because he cannot touch the buttons on the screen. Oh, articulation. Miss Amanda Gordon. She had an articulation disorder, could not say her R's and a few sounds. And so articulation is where we fine tune the tongue, the teeth, and the lips on how to say certain sounds. And could you imagine how different the conversation would have been if she couldn't say her R's or S's? It wouldn't have been of how beautiful her poetry was, how intelligent she is. It would have been a completely different conversation. We do feeding and swallowing. Babies who come from the NICU have a lot of sensory issues and they might have a G tube. And then swallowing disorders sometimes come after someone has had a stroke. So on the right side is an image of a modified barium swallow. That's someone swallowing a liquid that's been mixed with barium. So there is a very medical side to speech therapy. Stuttering is something we do a lot as well. Our president, Joe Biden, he stutters. Marilyn Monroe stutters. Her breathy voice is a therapy technique that we use for stuttering. And voice. We work with individuals who are transgender to help them ensure that their voice is someone they identify with. So we'll give them different techniques on how to either raise their pitch or lower it in a very safe way. And a typical treatment session for me looks like this. I work with early intervention, so that's 6 months all the way to maybe 5 years old, and I play. I do very intentional play therapy with houses, games, trains, anything my students want to work with. Yeah, and that's in a nutshell what I do.
What encouraged you to give your presentation to our high school students?
That's a great question. I wish I learned about speech therapy before. I wish I knew it was out there so that I could have gone straight into it. But realistically and honestly, my journey helped me realize that this is a perfect career. But I think doing research on different careers really helps because it's not just doctors, lawyers, and nurses and teachers out there. There's so much, and there's so much in the world of rehabilitation that I just want to open the doors and help you guys start your research on the different careers out there. Yeah.
Did Katie prepare you for the career/major you are taking part in now? If so, how?
Yes, they definitely did. At King Drew, you guys, or we, because I was there, we are, from the moment you step in as a freshman student, you're required to be professional. You're required to use your brain to think. And I think that the curriculum really does push you to become a more independent thinker. And I use all of those skills in my job every single day.
Can you share some memorable moments from your career or life after leaving KD? And it could be good or bad.
Yeah. Okay. So most recently, I have been working with a child on the autism spectrum. He's 3 years old and says one word. And I've been seeing him for maybe a month now. And when I was there on Tuesday, I brought out my box of sharks that he wanted to play with. He looked me in the eye, which is not typical for a child with autism, and said a 5 word sentence: I want the whale shark. And I almost cried. Mom sat there and she was holding the other baby, like, oh my gosh, what's happening? But they've also seen a lot of success at home. And that's the most memorable moment I have now. But, you know, my job is full of them.
So, do you have any anecdotes or anything you would like to share, such as like advice or words of wisdom? If you do, please feel free to share.
Yes. Okay. So you guys are 11th graders. You're going to start applying for colleges soon. Is this the correct timeline? Um, Try out different things in college, new classes, volunteer, go out there and shadow um, different careers that you might be interested in, because it might just put you on a path that sets you up for something you absolutely love. And just know that in college, you might major in something and you might graduate with an English degree and end up doing something so very different because you decide to go to graduate school and really specialize in a different career path. So I see college as a stepping stone um, to the real world. So just know that you're not stuck, and just try different things. Definitely reach out to people who are in a career that you're interested in and say, hey, I'd like to sit down and talk to you. Maybe we can do a Zoom session. I would like to observe you. And I think doing observations and talking to different professionals helped me narrow down what I wanted to do.
Well, that's actually the end of our questions, but maybe the class has some questions.
Okay, so I'm going to go ahead and ask the rest of the students if you have any questions to go ahead and put them in the chat. And here goes one question. Okay, do you see the question? Did you study speech pathology in undergrad and grad school?
I did not. I studied English and I minored in history in undergrad, and I completed a post baccalaureate certificate to cover like the general classes that you would need to apply for a master's in speech language pathology. And then I majored, or my degree is in communication sciences and disorders for graduate school. There's another question. How did you land your first job in speech pathology? I I gained I gained I worked on my post baccalaureate certificate, which also allowed me to apply for my speech language pathology assistant license. I did that for 2 years, fell in love with it, and then I applied to graduate school, and now I am a speech language pathologist. And then, what is your favorite aspect of your job during COVID that you didn't have before? Um, I mm, it's having much more access to the child in their home. So we're using um, different things, like items that they have in their home. We're using more language during meal times if possible, to make communication more functional. Yes, Ms. Thigpen, I am with LAUSD. How has speech pathology changed my view on the world? That is a great question. Before I thought I was just really accepting of people, like, oh, people are people. But now it very much is, it's like opened my eyes to different disorders that I probably never would have learned about and different communication styles. So if someone, I've picked up some sign language, I do have an augmentative alternative communication app on my phone just in case somebody with a speech delay or someone with language disorder, we can communicate that way. I Yeah, so I'm much more open to different communication styles now. That is a great question. Could you speak about your different educational experiences at that large school in the desert and then a small private school? Arizona State was a great school because they gave me scholarship money, but they also had a variety of classes. So I took classes on Asian Pacific American history, Filipino history. They had different research opportunities with hospitals nearby. So I was able to work with my uncle on one of his research projects because and use that as college credit because they worked with the university. A small private school is definitely going to cater more to you. You spend the money, and I felt more inclined to say, this is not where I would like to see my learning go to. Like, this is not where I would like to be placed for a clinical internship. Let's talk about different options. So I definitely felt like I could advocate more for myself at a private college. But definitely, you definitely can in a bigger university. It's just, I felt a little overwhelmed. Have you ever had a team member who was more focused on getting through the day rather than helping the child? I think sometimes we have those days, um, but once you sit in front of your client and they have your full attention, the world kind of like goes away. So whatever stresses that I have, it definitely melts away when I'm sitting in front of my client and we're talking about sharks or we're playing with the playhouse. It's their time, and they definitely seek out that social interaction. So um, you can try, but the kid is not going to let you just get through the day. They definitely want to play and have fun in speech. The hardest part of my career might be the paperwork. It is a lot to write reports and daily notes, but that's something that you do with practice. I was an English major, so I was used to writing a lot and in a more narrative style. I also think that keeping up with research is a hard part. It's Our field is very focused on evidence based practice. So, therapy techniques that have been researched and are shown to be effective with these different disorders. But there are ways around it. There are apps, there are subscriptions. People are trying to make it easier for us. Can my day get really hectic? Yes. On Wednesdays, I see 22 students, but that's in groups. So that's about 7.5 hours of therapy that I do in an 8-hour workday. Um, but on Fridays, if I don't have any IEP meetings, I get to write and make therapy tools. So that's fine. Yes, I do have a good work-life balance. I think that once I shut off my computer, I can walk away from my job. However, the therapy brain never shuts off. So if I'm watching a show and there's someone that has a lisp, my ear is tuned in and I am listening to what they're saying. So yeah, that's what I'm working on, is turning off that therapy brain. This is another great question. How did I feel going through my master's, even though I had a degree in something different? Did I feel like I was behind? There was definitely a chunk of our cohort that came straight from from undergrad in speech language pathology. Um, but because I had the year where I did the certificate to do my coursework in speech language pathology, had the background of being a speech language pathology assistant, I didn't feel behind. I had that experience with the students in therapy rooms that really helped me in my clinical experience throughout graduate school because I had to do, on top of my graduate classes, 400 clinical hours of therapy and assessments. So I had my toolbox of therapy tools that I love to use, and I feel like we all worked together to help each other, but I was definitely someone that my classmates looked to when they needed help with therapy techniques. So I didn't feel like I was behind. And there were also people who were in their second or third careers in their 40s and 50s and just loving what we were doing. So it's never too late to go back and try something else. How would my job differ from a special needs teacher at an elementary school? So, my job is a lot more specialized than a special needs teacher. I don't know how they teach English, math, science um, to these kiddos because I focus on communication and how that can help them in the classroom or at home. Um, and in a school, I typically see my students for 30-minute sessions. So my time with them is a lot shorter than a teacher who has them for 6 hours. Are there any other positions, careers in the speech pathology world? Yes, they have a desperate need for researchers, professors, people who will create the assessments that we use regularly. Um, a few people that I know went into speech therapy and decided they would open their own clinic, so they're more on the business side. You'll see speech therapists who are heads of rehabilitation centers, so they're helping like guide the speech therapy programs at that particular rehabilitation center. Um, yeah, I hope that answers that question. Do you guys have any other questions?
I'll ask a question. Mine's more of a visible, visual. So it was probably like 15 years ago. I met someone, she was a teen, and you were speaking about working with individuals with no voice. So she was really smart, but had minimal muscle ability. And her mom had, at that time, it was like a flip card. And she'd say like, what would you like to eat? And then she'd kind of go through letters at the top and stop. Like
Yeah.
there was just a little nod and she'd go B, and then she'd flip a card and was like, but oh, you want a banana? And I just kept thinking at that time, it was effective, but it was so time consuming. Could you talk about some of the technology changes that has happened and that they have available now? Or
Sure.
maybe they still use that, I don't know.
They do, and that falls under the AAC in my specialty. So thank you for asking. Um, Sometimes it's more accessible, or you know when you practice something a lot, you just become really good at it, and especially if your communication partner understands and has practiced with you, that might be more functional for them. We use a lot of picture cards, especially early on, to see if this method of picture communication system will work for the student or the adult, because sometimes adults after a stroke will have difficulties with language or with vocalizing their language. And the technology has just grown. Even when I was in grad school, the iPads are so accessible, the apps are incredibly expensive. Um, it might be $300 for a speech generating app, but I mean, they have just tailored it, and you can just specialize it just for this child, add pictures of like Mickey Mouse or their favorite toy. And it's really interesting to see, especially and use, especially with those kids who have a very tight circle of things that they're interested in. Yeah, that and through Zoom. So a lot of areas who that have really needed a speech language pathologist are accessing them through telehealth. Um, and so that way we're able to reach almost anyone.
That's also my plug for biomedical engineering. Those of you who like engineering but like to come up with things that help people in a medical setting.
Yes, help us create different speech generating apps that are a little bit more affordable and accessible to people. Oh, and really interesting is that there are different programs online that you can use to donate your voice, because some people don't want to sound like Siri. That's not who they identify with. So they can pull through this library of who they want to sound like. And I think that's really interesting too. Do I have any experiences with kids that aren't showing any progress and what happens to them? That's a great question. My students, I work really hard for my kids, but there are some that stump me, and I go back to the research. I go to my colleagues and I say, "Hey, I have this student. He likes this, and here are his goals. However, we've seen a plateau for the past few months. What do you think I should do?" And that's why I work really closely with my supervisors as well. Sometimes we take a break from speech therapy, and then they'll come back in a few months. But usually it's a team effort. So my supervisor will come and sit in. Maybe they see something that I don't, and they'll pull from their expertise that way. Yeah, we don't give up on our kids. That's 100% not going to happen, because communication is the essence of us being human beings, and the kiddos that don't have a voice definitely need some sort of way to communicate their wants and needs. For someone who is looking to go into speech pathology, do you mind giving an estimate of the college costs when you've finished your master's? Um, that's a great question. So Chapman University is 36 or $7,000 a year, and you are there for 2 years. Cal State LA does a similar program for 2 years, and I don't know the numbers on that, but it's less than half, and that's something but these colleges that have these programs are they're they're very competitive. There was a 5% chance that I was going to get into graduate school my first time. Thankfully, I did, but there's such a need, such an interest in speech language pathology that it is difficult to get in. But you know what? We make a lot of money. So somehow we figure out how to get those loans or those costs covered, and speech language pathologists do um, we do qualify for some of the federal loan relief programs, so that's something to look into as well. Is there an advantage to getting a doctoral degree in my field? No, not right now. Other than the title, there's not a huge need for doctors in the program. Um, Thank you, Miss Cooper. There's not a huge push for a doctoral program in speech language pathology. Um, you could, and you could get your doctoral degree and become a researcher and a professor, which is something that this field definitely needs. And just to let you know, like if you are interested in research, but you're looking at the doctors and you're like, how do you find what you want to research? Because everything's been done. Speech therapy is a field that we're we have some great research, but we definitely need some of those smart minds to help further our field. Any other questions? You guys have been giving me some great ones, so thank you.
I was very impressed with the questions. I'm like, okay, students, you guys have been listening. Good questions. And now we all want to go and learn more about this degree because I just went online and Cal State, yes, is much cheaper, but getting in is the problem, right? You're saying it's very competitive.
Mm-hmm. So that's why the observations, the volunteer work before will set you aside. Also, this is a field that only has 7% people of color. Um, so go and represent because it's hard. It's hard being one of the only ones at a conference or, standing up for my Asian Pacific Islander side. Like this is why we do things and this is um, why it's important.
Very good point.
And I'd just like to give a shout out to the speech pathologists. With my experience, my daughter, when she was in kindergarten, her kindergarten teacher, so again, it's a partnership, called and said, I'd like our speech pathologist to listen to her. And I knew she had a problem with her S's, like spider was piter. We
Mm-hmm.
had a dog named Spot who was pot. And, I thought, oh, she's just going to grow out of it. And she did with help from her speech pathologist. And it wasn't that long, but it was her learning how to say those words. And so really that combination of teachers working with the speech pathologist and getting them in a program and then boom, success. So thank you.
Yeah, I'm glad.
Yeah. Well, I thank you so much, Kelsey, for taking time to be with us today. We really appreciate it. And my favorite part is really learning all the wonderful things you've been up to. So impressed and very proud and happy that you were able to come today. So thank you.
Thank you. Should I leave my contact information in the chat?
You
Please
may.
email me if you have any questions, if you want to sit down and talk. I am so grateful for the people that took time out of their day to talk to me about this field. So, any questions, let me know. You're welcome, you guys. Thank you for being such a great audience.